Let, let's not change topics, but
Mhm.
um, I, I wanted to ask you. I had a patient, this morning who had texted me the day yesterday. He had a new complaint, or at least a new episode of a flare up. It was significant, and when he came in to see me today, I had, an idea of what I wanted to get accomplished so that I can get the relevant information
Mhm.
in terms of the assessment so that we can give him something to obviously reduce his pain. And my brain going into maybe not the greatest thing in the world, but going into it was, okay, I don't want him to ramble on and on about his history. I want to get some vital information from the history and get to the assessment so that I can get to what I need. And when we do our assessment course, and even in the standard DNS courses, you'll often crack the joke that, like, I'm not Pavel Kolaj who doesn't want to hear any history. I'm just going to blindly assess you and miraculously treat you and tell you what's wrong with you. But there is a certain amount of, I don't care what you're going to tell me. I'm going to do this standard global assessment to get findings and make corrections based on the findings, because what you're telling me is only somewhat relevant. So from that I kind of thought, so what how do you view the history taking? You know, are there particular is there particular information that is more vital to you? Is there information that you go, oh, that's nice to know, and then you just never think about it ever again? What kind of information? How do you view the history now that we have this assessment framework that is based on the collection of data and all these standardized tests that make the history almost somewhat irrelevant?
Well, I really love the history. I have to tell
Okay,
you,
forget it. Forget it.
because the history contains nuggets of observation that the patient can tell you that you are not party to. However, I think it's not that I don't, like you said, we don't care. We care for the history, but it doesn't change our process. That's all. The process is not changed by the history. The process is standardized, but it is enriched by the history, and the history gives me two things. One, is this chemically driven pain, or is it biomechanical driven pain, or is there a large psychological component to this pain or discomfort or this problem, whatever the problem is? So, first, to try to find that out is important so that I can, even if I'm going to go down the process of rehabilitation, I can initiate first aid procedures that are appropriate to the patient's status in terms of his pain experience. So that's one aspect. The other is I need to know, is this a traumatic or a repetitive injury um, uh, mode of symptoms? And in that, could this be something that is even more malicious in nature because a it does not have a particular cause? And is it something that is going to need a global or truly global treatment? So that if, yeah,
Like a referral to a
that's
specialist or something.
right, and may be something serious that is masquerading as something rather benign.
So
So
let me
for
just stop you a
yeah,
second. So, first thing you said, which is clarifying, is that the history is only irrelevant in terms of it isn't going to change our assessment. The assessment
No.
procedure is the assessment procedure.
Yes.
That's the only reason or why it's so-called irrelevant. The relevance for you initially is, well, let's use the history to find out, is this more of a chemical inflammatory kind of or is at least primarily driven by chemical inflammation,
At this point.
or is it a bit more mechanical, or is it a bit more psychological, psychosocial?
Mm-hmm.
From there, it's also not a secondary thing, but then it's okay. Well, was this a traumatic injury? Is it a repetitive strain?
Is the reason for
repetitive
the injury known or not?
Okay.
Yes. Is the reason for the injury known or not?
Right.
And does the patient
within that,
suspect, yes, that they know?
Within that is also I have no idea why this is happening and doesn't seem to have a pattern. And now your brain starts to think, well, maybe something a little bit more serious or
That's
something
right.
is going on.
And in that way, it biases the process in that it makes me now add in more assessment, remove a certain focus of assessment, and so on. So to the basics, I either add or I go, okay, will direct me. I will go through the process, but I am aiming to move towards a conclusion, unlike something where I'm like, no, this one is going to take more assessment, more time, and the assessment may not end on day one. It might need further investigation, or it may tell me that the information I have is absolutely inadequate and that it is risky to proceed. So in those cases, I'm not willing not to take a history because it's one thing if somebody's brought in and can walk and appears in no imminent distress. But it's quite different when you're in the clinic and somebody might be in imminent distress. This is not the time for me to guess what's going on with them. Yes. So but the history is always fascinating. And some people are good storytellers, some are not. And some people are chronological in their history, and some people are scattered. And so one should be prepared to focus not on necessarily the order in which you receive the history, but have certain nuggets that you're looking for to fulfill those questions that I have. For example, do you sleep at night or does this wake you up? Because, somebody can say, oh my God, it's a 10 out of 10. I go, but you sleep through the night. Yes, I yeah, my sleep's not just, okay. So obviously it's not a 10 out of 10 in reality, because if it was, you would fall asleep. Or it comes and goes. So those kind of things are really important. No, I don't. I sleep on the floor. You're in some serious, when you abandon your bed to sleep on the floor, you sleep upright in a chair. We're talking serious changes in your life.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.